Hello everyone, good morning. Welcome to St. Camillus de Lelis General Hospital. I am Flor-Elise and I will be your training officer who will be in charge in orienting and refreshing you to different common necessary nursing skills that we nurses have to familiarize in order to carry out the doctor's orders immediately and confidently. The teaching strategy that I will be utilizing is the lecture method, also known as the transmissive method. The lecture method is based on vertical learning, which is used in order to acquire knowledge and concepts. Also, I will be utilizing audio-visual aids in order to successfully convey the objective of this lecture video. The general objective of this lecture video is to perform one of the most fundamental nursing skills, which is intravenous cannulation, while maintaining patient safety. Your goal should be to get comfortable with initiating IVs on real people by yourself. Becoming comfortable may look different for new nurses. This is one of those skills that can save you a lot of time and frustration for yourself throughout your career if you master it as soon as possible. Before proceeding, let me discuss to you the purposes of IV therapy. First, to supply fluid when the clients are unable to take in an adequate volume of fluids by mouth. Next, to provide salts and other electrolytes needed to maintain electrolyte imbalance. Third, to provide glucose or dextrose, which is the main fuel for metabolism. Fourth, to provide water-soluble vitamins and medications. Fifth and lastly, to establish a lifeline for rapidly needed medications. 90 to 95% of patients in the hospital receive some kind of intravenous therapy. This lecture video will enhance your knowledge on how to care for them. First step in IV cannulation is to verify the doctor's order. This step will ensure safe and correct administration of IV therapy and appropriate selection of vascular access device. And second, introduce yourself and confirm the identity and date of birth of the patient. This step will minimize errors in cannulating the wrong patient. Third, explain the procedure to the patient in order to gain cooperation for a smooth initiation of IV cannulation. Next step is to wash your hands and gather all the materials needed in the initiation of IV cannulation. So we are now going to gather the materials needed for IV insertion. Here is an example of the IV catheter tray. What is inside our IV tray? Let's take a quick look. There we have the gauge 22 or the color blue IV catheter. We also have the green IV catheter or the gauge 18. Next, we have the pink IV catheter or the gauge 20. We also have the transport. Here is the Tegaderm film. There's our tourniquet. We also have a saline lock. And we also have a connector. In needle selection, keep in mind that catheters vary in sizes called gauges. The smaller the gauge number, the thicker the catheter, and the more rapidly medicine can be administered and blood can be drawn. Furthermore, thicker catheters cause more painful insertion, so it's very necessary not to use a catheter that's larger than what you need. The tip of the catheter should be inspected for integrity prior to venipuncture. Only 2 attempts at venipuncture is recommended. Here is an example of a table wherein we can see the size, the color, and the recommended use of every IV catheters. First, we have the orange or the gauge 14. It is mainly used in massive trauma situations. Next, we have the gauge 16 or the color gray IV catheter. It is used for trauma, surgeries, or multiple large volume infusions. Next, we have the gauge 18 or the green. It is used for blood transfusion or large volume infusions also. We also have the pink or the gauge 20. It is a multi-purpose IV for medications, hydrations, and routine therapies. Next, we have the color blue IV catheter or the gauge 22. It is most common in chemo infusions, patients with small veins, elderly, or pediatric patients. We also have the gauge 24, the yellow. It is mainly used for very fragile veins for the elderly or pediatric patients. Lastly, we have the gauge 26 or the purple IV catheter. It is also used for neonatal patients. Other materials that are also needed in the initiation of IV therapy includes IV solutions and the macro set or infusion set. Again, we have to double check the doctor's order if they require IV solutions in the initiation of IV therapy. After washing our hands and gathering all the materials needed in the procedure, we are now ready to proceed with the next step. Next, we are now going to don our gloves. Just a reminder, wearing gloves is not optional. The possibility of contact with the patient's blood while it's starting an IV is high, especially with inexperienced healthcare workers. Gloves must always be present and be worn during catheterization. Moreover, if the risk of blood splatter is high, such as an agitated patient, the nurse should consider face and eye protection as well as wearing a gown. Once you've done your gloves, you'll be now preparing the site of insertion. Apply antimicrobial solution, working from the center outward in a circular motion for 2 to 3 inches for 20 seconds. Use enough friction. Just a reminder, do not shave the side because shaving can cause microabrasions. You can use to remove the hair with scissors or clippers only. We are now ready for the insertion of catheter into the vein. First, place the extremity in a dependent position or lower than the client's heart. Gravity slows venous return and distends the vein. Distending the veins makes it easier to insert the needle properly. Next, apply a tourniquet firmly 1.5 to 2 centimeters above the venipuncture site. Explain that it will feel tight. Tourniquet must be tight enough to occlude venous flow, but not so tight that it occludes the arterial flow. Obstructing arterial flow inhibits venous filling. If a radial pulse can be palpated, the arterial flow is not obstructed. Massage or stroke the vein distal to the side and in the direction of venous flow towards the heart. This action helps fill the vein. Encourage the client to an unclenched fist. Contracting muscles compresses the distal veins, forcing blood along the veins and distending them. Light up the vein with your fingertips. Tapping may distend the vein. If the preceding steps fail to distend the vein so that it is palpable, remove the tourniquet and wrap the extremity in a warm, moist towel for 10 to 15 minutes. Heat dilates superficial blood vessels, causing them to fill, and then repeat step 1. Next step, insert the catheter and initiate infusion. Use the non-dominant hand to pull the skin taut below the entry site. This stabilizes the vein and makes the skin taut for needle entry. It can also make initial tissue penetration less painful. Hold the over the needle catheter at 15 to 30 degree angle with bevel up. Insert the catheter through the skin and into the vein. Sudden lack of resistance is felt as the needle enters the vein. Jabbing, stabbing, or quick thrusting should be avoided because it may cause rupture of delicate veins. Advance the needle approximately 1 centimeter. Once blood appears in the lumen or you feel the lack of resistance, lower the angle until it is almost parallel with the skin and advance the needle approximately 1 cm. Hold the needle portion steady and advance the catheter until the hub is at the venipuncture site. The catheter is advanced to ensure that it is and not just the metal needle is in the vein. Once you see the flashback, you can now release the tourniquet. Apply pressure on the vein proximal to the catheter to eliminate or reduce blood oozing out of the catheter. Stabilize the hub with thumb and index finger of the non-dominant hand. And then, remove the protective cup from the distal end of the tubing. Hold it ready to attach to the catheter, maintaining the sterility to the end. Carefully remove the needle and engage the needle safety device. Then you can now attach the end of the infusion tubing to the catheter hub. Then you can now start the infusion. We can now secure the catheter by taping the catheter by the U method or according to the manufacturer's instructions. And then after that, we can now dress and label the venipuncture site and tubing according to agency policy. Label should have date on which administration set must be changed, and the venipuncture site should also be labeled with the date and time and the type and length of catheter. Remember to practice aftercare after the initiation of IV catheterization. Let us do proper equipment disposal. Needles and stylus shall be disposed of in non-permeable, tamper-proof containers, and dispose all paper and plastic equipments in a biohazard container. After successfully initiating IV therapy, do not forget to document the relevant data, including assessments. Also, patient must receive information on all aspects of their care. After catheter is stabilized, dressing is applied, and labeling is complete, inform patient regarding any limitations of movement or mobility. Also, instruct to call for assistance if any puncture site becomes tender or sore, or if redness or swelling develop. Before I end this lecture video, I would like to ask the new nurses if they have any questions or concern regarding the initiation of IV therapy. If you have, guys, you are free to click the button below and type in your questions, and after that, I will email you my responses as soon as I can. Thank you so much for your participation in today's lecture video on the initiation of IV therapy. Once again, I am Flor-Elise your training officer in St. Camillus de Lelis General Hospital. Have a wonderful day ahead.